According to the National Heart and Lung Association, more than 2 million people carry the sickle cell trait. It's a condition that affects 1 in 12 African Americans. Here to tell us more about it is Jennifer Harris Sherman, Executive Director for the West Alabama Sickle Cell Association, one of West Alabama's many nonprofit organizations. Thank you so much for being with us.
Thank you for having me today.
Sure. For the folks at home that may not be familiar with sickle cell, tell us a little bit about what this is.
Sickle cell disease is an inherited blood disorder. It is genetic, so it is from birth into death, and it is a lifelong condition that affects the red blood cells. The red blood cells, a little science lesson refresher, carries oxygen throughout our body. And when you have sickle cell disease, your red blood cells are either abnormal in shape and or size, and therefore it does not maximize the oxygen that is carried throughout your body. Therefore, you are at increased risk of having severe pain crises, the most common symptom. That symptom can last anywhere from a few hours to months at a time, requiring hospitalization and constant monitoring. Also, individuals with sickle cell disease are at increased risk of having organ failure, stroke, and a myriad of other illnesses and ailments that may affect them. So they also have to regularly make sure they're seeing a specialist and their regular physicians for care and maintenance.
What type of services do you all over at the West Alabama Sickle Cell Association offer for people living with sickle cell?
We offer a number of services for those with both sickle cell disease and those that carry sickle cell trait, because sickle cell trait is different from sickle cell disease, and a lot of people don't know that. So one of the main services that we do is we educate people about those differences and what they are. Usually if someone has trait, they typically don't have symptoms, although they could, in rare situations, have symptoms that mimic sickle cell disease, but it would never turn into disease. So we want to make sure that they have that information, especially if they're athletes, as now testing is a big issue with athletes because all collegiate athletes were tested, as well as if they do certain things such as go into the military, or in certain rare instances in which sickle cell trait can mimic disease, we want them to have that information.
Now, you all have a health fair that's coming up?
We do have a health fair coming up this Saturday. We are working with the Zeta Phi Beta Stoic Sense program and Friendship Baptist Church here in Tuscaloosa, and we will be co-sponsoring a health fair this Saturday from 10 to 2. At that health fair, we'll be offering education, not just about sickle cell disease, but about a lot of other health things and screenings that are all free of charge. We will also be doing free testing at that event, and we also do free testing for sickle cell trait out of our office in Northport as well.
Now, where is this health fair going to take place this Saturday?
It will be at Friendship Baptist Church. I currently do not have the address for that, but I'm sure someone can look that up.
So at Friendship Baptist Church in Tuscaloosa,
yes,
from 10 to 2.
From 10 to 2.
And it's free testing for sickle cell. And it's
free testing for sickle cell trait, and also free screenings for blood pressure and cholesterol, and free health information from the health department and some other health service providers and agencies in the community.
All right. Thank you so much for being with us today. And we have a phone number where you all can get more information. You can find out about sickle cell of West Alabama by calling this number, 205-758-1761, or visit their website at sicklecellwac.org.